And welcome back. I'm Malia Allen. If you're just joining us, we're on the iLifestyle Gulf Coast set. And with me today are two of Dr. Giovannini's probably favorite patients. He kind of told me. And I have with me Alan and Betty Lacy. And Mr. and Miss Lacy, you both have had surgery with Dr. Giovannini in the past, what, 9 months or so, 10 months?
Mine was in September, so it hadn't been that long.
Mine was March.
Okay, so you just recently.
Right.
Okay, so Alan, tell me a little bit about how your symptoms started, because I know you both had the SI joint fusion done. How did your symptoms start?
Mine started when I lifted a printer out of a cart and tried to put it in my truck. As soon as I picked it up, it was heavier than I expected, and I got instant pain in my hip.
Wow.
Right there in the SI joint. I got pain right in here.
Okay, so on one side, on the right side?
Only on the right side.
Only on, had you had back pain before or ever?
Yes, I had had several back pains.
What kind of?
Well, it started with my neck in 2013. Then it went to the middle of the back and then the lower back. I've had surgery all the way down through my spine.
So you have had prior back surgeries?
Yes, I have.
So you're well acquainted with back pain?
Oh, yeah.
Oh my, and you know as soon as you feel it, you stop, don't you?
You do that.
It has a way of stopping you dead in your tracks,
Yes,
huh?
You got to listen to your body.
So then what did you do after that? What happened?
I waited on Betty to have her surgery because I knew I was going to have to do something. And so she had had pain for a lot longer than I had. And I just suffered through it until it was time to get mine done.
Okay, so immediately after leaving the Best Buy, I think is where you said you were, in the parking lot, what did you do? Did you contact Dr. Giovannini or?
No, I didn't do anything for a while.
Okay, so Betty, what happened with your back? You have a history of back pain as well?
Yes, I have. I do have the spinal cord stimulator, and it just kept getting worse. More pain pills, you know, everything. I decided that I saw Dr. Metzger and he says, I want you to see Dr. Giovannini. So I saw him. He knew exactly what was wrong with me, and he started the shots in the process
of evaluating what was wrong. Okay.
Yeah, I had shots and physical therapy, lost a little bit of weight, and was trying to stay active.
Right.
But with mine was going down my leg.
Okay.
It affected me when I took a step. It affected me when, you know, I was trying to walk sometimes. I would fall. So
you just don't feel your foot striking the ground, do you?
Because of the pain.
Right.
But I did fine. I mean, it's been wonderful. The pain's gone, no more medicine.
That's fantastic.
Yes.
So one thing I remember about having the back pain and having surgery, because I'm also a patient of Dr. Giovannini's, was that we thought it was SI joint because I had radiating pain, and that's one of the things they want to eliminate before, because that radiating pain can be disc related, and it can also be, what we've learned from Dr. Giovannini is it also can be SI joint related. Betty, you said that you had had other back pain before you had this pain. Did you have any neck or mid back, low back issues before?
Mine was low back. I've never had the neck or the middle back, but just low back.
So you kind of fought that for how long? How many years?
Oh, long time.
Long time.
Long time. And eventually we're going to do my left side until it gets bad enough.
Right, but you had never had surgery before this, before you met with Dr. Giovannini.
Nope.
So you said you walked into his office and you didn't know if it was disc related or SI joint, and when you saw him, you told me before we turned cameras on that he pushed his finger right in your right side, your right hip.
And he was doing the exam, and next thing you know, almost to my knees. It hurt, you know, and stuff.
Replicated that pain.
Yes, it did.
Surgically, it's a pretty simple procedure. How easy was it for you to recover?
I didn't have a problem. I mean,
I'm still recovering a little bit, but I mean, right after surgery and after the anesthesia wore off, I could walk and everything else that I couldn't do before.
And you didn't feel that same pain in your low back?
It wasn't the same pain, no.
Wow. And you've only been out of surgery for what, 8 weeks or so?
Yeah, about 8 weeks.
8 weeks. So what did you like to do beforehand that now you're able to do again?
Go for a walk, for one thing.
yeah.
Just walk, right?
Just walk.
crosswalk.
Isn't it amazing how back pain can sit you down? What would
It
you tell
does.
What would you tell people who are out there who are thinking, you know what, if they're my age or above, 55 plus, and they think this is just something I have to live with? What would you tell them, Betty?
No, you don't. You do not have to live with back pain. There's options out there for you, whether it is spinal cord stimulator or if it is that SI joint, you can get it fixed and you will be 100%.
And walking again within, what,
Walking.
6 or 8 weeks, huh?
Oh, it didn't take that long.
No,
Not even that long.
long. No.
Probably 2 weeks. I was
Yeah,
walking very
we're-
well.
Perfect.
Outstanding. Thank you so much for telling us your story. We certainly appreciate it. We'll be right back.